Yes.
So
Yes,
it's
so
always
true.
nice to have that added support in studio. So, good morning to all of our listeners, new and regular. This morning, before we start, we have a special guest with us. She will be joining us shortly. But before we start, would like to say some special words.
Oh, yes, fun.
Yes.
Well, first of all, I got a special request to acknowledge Miss Anne Marie Felix. She'll be holding the baton, and she'll be running
The
from.
Independence Day baton that's going around. I hope everybody has been following. I saw Viewfort South had quite a jam yesterday, and I hope that it will be replicated throughout the rest of the communities as the baton continues to travel through. So, Chozel, power call.
Yes, as Shozelians, proud Shozelians, of course. We will not leave Choiseul behind. But let's say to all our Soufrierians and our listeners from countries, um, during the independence rally, don't forget to support your very own community members. Come out in your numbers, cheer on, and we want you all to continue doing that throughout, the independence um, activities. So Miss Anne, so I don't say Miss Anne, but Miss Anne Marie Felix. We will be there to cheer you on, and we hope all goes well for you. And Miss Anne is one of our listeners at Hotel Chocolat. So let me just say good morning to all our listeners at OJ's, Miss Odell, our MNC staff, our caregivers, all our persons out there underneath the market, bus drivers. We want to say happy good morning to you, and we would like to say that continue to listen when you meet us. Don't forget to give us feedback. We would really appreciate it, and encourage persons to call on our shows at least so that we know that you are listening out there, and we're making a very good contribution to the community. So hopefully we can improve on our show and bring out topics that you all are really interested in knowing and getting information about. All right. So without further ado, I would pass you on to Miss Minville Fawn.
Louisa, I don't think anybody really remembers my surname because, as you heard, Erlan introduces us as Fawn and Miss Wilson. So, yes, Miss Minviel is ready. So, our topic this morning is sexual and reproductive health. It is something that all of us, I mean, it's a part of our normal lives. Now, one of the reasons why we decided to bring up this topic this morning, being out in the community, sometimes people ask questions or people make certain statements, and we realize that there is quite a bit of misinformation, or people hold beliefs that may not necessarily be true as it relates to sexual and reproductive health, or there's just a gap in knowledge. People need clarification on quite a number of things, of issues. So, this is why we are having this topic this morning. And we are supposed to have a guest with us. I'm not sure if she's on yet, but in the interest of time, we will start off with a little definition from UNFPA. I think it is. Uh, on what is sexual and reproductive health. So basically, this is just to give you an idea of what really is involved when we talk about sexual and reproductive health. So, sexual and reproductive health is a state of complete physical, mental, and social well being in all matters relating to the reproductive system. People are able to have a satisfying and safe sex life, the capability to reproduce, and the freedom to decide if, when, and how often to do so. So basically, if you listen to this definition, it's saying that we should be all should be well when it comes to we talk about sexual health. It's not just about how much you enjoy sex. It should be physical, you should be mentally okay with it. And um as it relates to reproduction, especially for women, sometimes you hear about women tricking men and that sort of thing, but especially as it relates to women and the female reproductive system, because women are the ones who carry the baby and so on. So they need to have a say in when they have children, if they decide to have children. That should not be forced upon them, on neither women nor men. But as I said, I put the stress a little bit more on the women because of the fact that they are the ones who carry. So when it comes to control or decisions as it relates to reproduction and having children, procreating, as we often say, it is something that can be controlled to a certain extent by way of contraceptives, by way of abstinence. So there are two routes: abstinence and contraception. And in terms of contraception, we know that there are several different types of contraceptive. There are several different types of contraceptives out there that are available through the public system. We have barrier methods. When we talk about barrier methods, we're talking about the condom. So there's the male condom, there's the female condom. We have IUDs, so intrauterine devices, IUDs, what some people call a T or a clip. Some people call it a clip. So we have tablets, we have patches, we have um, what's inserted under the skin. So there are injectables. There are many different types of contraceptives that can be used. So this is basically what it's all about in terms of controlling our reproduction. Now, the problem sometimes lies not necessarily in the problem sometimes lies not necessarily in the availability or access to, but it lies with our own perceptions of whether we need it, uh, because we have our own preconceived ideas. We believe certain things. We believe that certain things work, and they work so well that we don't need to use contraceptives. Yes, so I'm just getting a comment here that says straight pipe. So I'm not sure what straight pipe means.
I never know that saying.
I've never heard that term, but if I were to make an assumption, I would. I don't think I can say that on modern radio. The term that I know, bear something. Yes, so bear something. All right. So we don't want to use con- any condoms, whether female or male. We just don't want any barriers. So in that case, if if you're trying if you're trying to control your rep- I'm sorry, I'm being distracted. If you're trying to control your reproduction, then that would mean that you would depend more so on the pill and other contraceptive methods rather than the condom. But and the condoms, male and female, play a very special role in reducing the risk of sexually transmitted infections. So, in as much as we're thinking about the fact, I don't want to say the fact. Okay, maybe I can say the fact. The fact that people say that
Mm.
bare is better than with. Okay, so many people hold that view that it feels better. It's a much better experience without a condom. So let us try to think beyond how it feels. What is the difference? Is the difference in the feeling so great that you're willing to expose yourself to possibly getting a sexually transmitted infection?
You have to
So we
assess
need
your
to
risk.
assess that risk and think about what we are willing to deal with. Because oftentimes people are of the view that they just will not get a sexually transmitted infection because they know the person or they can see what they're dealing with.
But
You have a
you know,
question?
those persons they're faithful, eh? Like they don't go
Yeah,
out
they
of their way to
are.
Yes,
cheat,
there
and
are people who
it's
are
on both sides, eh? Like
on both sides.
mhm.
And if you have that and it's working, then you can, as we said, you assess the
Mhm.
risk. So if both people are faithful, both people have one partner, the partner being each other,
Mhm.
then you assess your risk. You determine whether you want more children. You determine things like that. You look at all of these things to decide what, if anything, you would
And
use.
there's persons I feel the contraceptives don't work for them in terms of the pill or the injection, but I think they go for what's it called, a TL?
Yes, so
The
that is
TL,
that's a surgical.
right?
Okay. And I think doc would be better placed to be a little bit more specific
Look at it.
as
Yes,
it
certainly.
relates to the TL. So we'll just make a note so that she can speak a little bit more about it when she joins us.
Well, for in the meantime, let's speak about reality. A lot of people start and then they forget the condom, and halfway,
Boy, you
they
got
run
smile,
for the
boy.
little condom.
Boy, you got smile on the face,
They
boy. Boy, you
run
got
for the
smile on the
condom,
face.
All that's at the back of their mind. They into the groove and they forget the
Fun,
condom. I mean,
When you
that,
say
fun,
halfway,
fun, fun. Body language says a lot.
what
it
Face
is
says a
body
language.
lot.
language?
It
Yeah.
says a lot.
What you
No, but what
But
I'm
smile.
saying to you is like, sometimes you completely forget about the condom and you're already in the process,
That is
halfway in
it.
the process, you remember the condom.
That is it.
When
There's
you
a
back, you starting to think, and that's the time reality strike, and you saying, oh my God, what is happening there?
so
after you
And
reach
then you're going,
ecstasy.
okay, so
After you reach
Louisa,
ecstasy.
since
and
you
then you're going to take the condom, but all that time you already have
Fun.
unprotected
okay,
sex.
so
So
right.
that is
So
one of the
Louisa,
things people have to think about.
I was just going to ask you to take yourself out of that zone and then come back and think about it with fresh eyes. If you
Starting
have
eyes.
already started, what do you think
So that's
the
what I'm
risk
saying.
is?
I mean, you're already exposed, and that's what I'm saying to
Exactly.
you. I mean, some people do it, some people, they forget,
So
and that
nice.
happens to the best of all of us. And it depends on where you are, the position you're at, where the activity is taking place, So, all these things happen. So, you want persons to have that right frame of mind. That right frame of mind, you're going to indulge in these activities. Come well prepared,
Gotta be
especially
focused.
if you're
Yes,
condom. Yeah,
and
you have to be focused.
it's an individual choice and decision as well. So if you have weighed the risk prior and you have decided that you're willing to deal with whatever consequences may come.
Valentine's is coming.
Yes, and the other thing, fun. Sometimes you go out there and you don't have that intention, but one thing might lead to another. That means you always have to go well protected. You understand?
Well prepared, you
Well
said.
prepared, everything in its. You have to go out there with that because you never know what
So
can
whose
happen.
responsibility is it really now to
Both.
come prepared?
Both, 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 both.
Both parties.
And another thing is,
Because you know Traditionally,
Is
I
a
think women tend to depend when it comes to
well,
condoms.
not these
Women
days,
tend to
eh?
depend on the man to walk with the condoms. And there's always their perceptions out there among men. I'm sure Erlan may be able to help us that if you see a woman walking with her three condoms in her purse,
That means you're
what
going to cheat or you
what
are,
perception
Boy,
is
I tell
out
you,
there of that type of woman. So these are the type
uh,
of things that we need to get past in
yeah.
order that both people can have the same level of
And
responsibility as it
fun,
pertains to
that's a
that.
nice thing you brought that up because come to think of it, a woman having condoms, that's at one time, like, again, there was some stigma attached to that.
Mm-hmm.
But really and truly, boy, women have fallen victims to rape. And certain, they cannot fight it. The offenders or the persons are actually doing because they were two the victims. But I was watching this documentary, and this lady said to you, "Thank God she had a condom because she was a rape victim, and she couldn't hesitate because she couldn't fight that boy because that one could have killed her." She told you. So what she did, she actually just put a condom,
hmm
all right. And what she did was one of the best thing. The man was an escape. He was from jail, and he was a HIV. He had HIV. So imagine if she didn't have that condom.
Yeah, but in our everyday relationship, when you have a relationship with your partner at home, especially if you use condoms at home and you decide to buy the condom, a lot of men
Yes,
feel
yeah, yeah.
offended.
There's stigma after that.
A lot of
Oh,
men feel
yeah.
offended. They feel that you have another partner out
Uh,
there and so on. So these are things that, reality in our
right. Okay.
community.
Head that. You said females, right? I
Yeah.
got you short. What if me? I get condoms in my wallet. What would she think?
Well,
If you ask my
like
girlfriend if you want condoms,
if you don't use condoms, and all of a
right?
sudden you have condoms in your wallet, why do you have it? We don't
Phone.
use it at home.
She made a point a while ago. Now I draw my point. So it goes both ways.
So why do you use? Yeah, we don't. You don't use it at
But if,
home. So
as you
why?
said, you're in a relationship where both of you have agreed that you're not going to use because both
So
of
I
you
shouldn't
are
have
faithful,
condoms.
You shouldn't have
there's no
condoms. There's
reason
no
for
reason
you
for you
to
to have
have
it.
it.
Are you going to buy
So
it for the partners, or you keep it for just in case?
Yeah, my partners, my
What's
friends,
what possible reason can you
and
have?
that
my buddies.
and
Not
that
for your buddies,
and
probably.
that forms a part of sexual and reproductive health in the sense that
Communication and trust.
the relationship is important. The relationship is an ex is an important part of sexual and reproductive health. So it's not all about sex, it's about our connection, relationships. And Louisa mentioned something about having a partner, and I want to just go a little bit into that. There are some people being in a couple, they believe that they have a right to have sex with their partner at any time,
That's
whether
mine
the
that day.
partner wants it or not. And that in itself is not a correct approach, because you may want to have sexual intercourse with your partner 5 times a day and your partner only wants it once. That does not mean that you have a right to try to coerce them
Or
or
taking
to
from
try
them.
to make them feel bad about it or to just take it because it's mine, that sort of thing. If you're
That's
just
true.
taking it without their consent,
That's rape.
then
That is
exactly.
rape.
So having sex
Exactly.
is not
Even
rebellion.
within relationships. So rape is not necessarily something that you talk about in terms of you walking down the road and somebody jump out of the bush and assault you and rape you. It can happen in relationships as well.
True.
So I think our guest is here. So is she ready? Doc, can you hear us?
Doctor, oh, Jesus.
Dr. Durand, can you hear
Yes,
us? Wonderful. Good
I'm
morning to
here.
you, Dr. Durand. Our guest is here with
Morning.
us. Doc, before we started because there was a little delay, so I will guide you. We will guide you as we go along. But before we go ahead, could you just introduce yourself? Tell us a little bit about yourself, and then we will move into the statements from where Louisa and I left off.
You
Di-
hear? You heard what she said?
did you hear me, Dr. Durand?
I don't know what. No.
It's good on our end. Yeah. Okay, we lost her for a
All
minute,
right,
guys.
so we lost
She's getting
her.
back.
We will try again to bring her in. So that aspect of sexual and reproductive health is also important. So we tend to focus a lot on sex and procreation, but looking at the relationships and the level of communication, the the level of trust, there's a lot that goes on. I deliberately did not talk about rights. I mentioned it briefly. We just decided to do sexual and reproductive health, but it comes with the rights. There are quite a few rights associated with sexual and reproductive health. We can deal with that in another show. Maybe, it would probably have been a little too much. We wanted to focus on the things that come up while we are out there. So consent is an important part of it as well. Okay, let us look at some of the statements that have been made, or questions that have been asked out in the field. And one of those relates to, I think Ellen might have alluded to it a little, um, the withdrawal or pull out method. So we talked about condoms, we talked about
Bail off.
the bail off. Yeah, bail off. And I said what?
Withdrawal.
Withdrawal. So mun pa kay ko pon sa Nadia.
You
You
got
kay
go
ko
one.
pon. Bail off. So the bail off method as a contraceptive
Stock is
method.
back.
Okay, Doc is back. So I'm going to check whether she can hear us. Dr. Duran, can you hear me?
I can hear you clearly now. I changed it. I switched the
Oh,
phone.
wonderful. So, Doc, I was saying to you earlier, because of the delay in you joining us, we started off, but we will guide you as to where we are. But before we get into it, could you just introduce yourself briefly? Tell us a little bit about yourself.
Okay.
Dr. Duran, did you hear me?
I can hear you now. I am. Good morning, everyone.
Morning.
I am Dr. Shaelle Durand. I'm a consultant gynecologist, obstetrician. So I'm working at the Vifodel Center in Bodile for SRH management for the Ministry of Health.
Okay, wonderful. So, Doc, we started off, and I will just go straight into it in the interest of time. We talked a little bit about contraceptive methods, and we were just mentioning that there are quite a few people who believe in the bail off or withdrawal or pull out method as a type of contraceptive. In terms of that bail off where no condom is used and then you pull out before ejaculation, what wh- what guidance can you give in terms of that being an effective or ineffective method of contraception?
Can you go ahead again for me, please? Because I don't get when you pull.
pull out or bail off. So that is the term that we use when two people are having sexual intercourse, and
Mm-hmm.
before ejaculation, the man withdraws. So,
Mm-hmm.
how effective is that as a contraceptive method? And are there any dangers associated with it that you would like to share with the public?
Um, as contraceptive method, I will not say it is. If you can hear me,
Yes, we can hear you clearly.
yes, I will not say is a at this point, even though it withdraw it, I will not advise as a contraceptive it will work because the thing is, remember, for the semen they have the liquid will come in first before the ejaculation is still a fertile one. So sometimes that is why some women feel that strength. So even though they pull out and then they still get pregnant, because the thing is before the ejaculation itself, the semen is still alive with the first liquid. So
So,
that means this one can still be fertile to meet the ovule and then to for the fertilization. Yeah.
okay, so that can still cause pregnancy and exposure to sexually
Yes, it is
transmitted
a trap.
infections.
Yes.
Okay,
So
so
that doesn't mean because the method is a contraceptive, even though the condom, sorry, even though you pull out and then they have a direct contact with the penis inside, so there is still possibility to get pregnant or to get a sexual infection.
All right, very. I like that, doc, because there was a myth going around saying that come to think of it, if so we have an intercourse, and if I don't ejaculate inside of you or you don't have a cut, I can't get a transmission in terms of HIV, AIDS,
or
or sexual,
sexually
whatever the
transmitted
case. So
infection.
thank
No,
you.
that is not unfortunately, the ejaculation will not determine whether you can get pregnant or get in sexual infection or not, because it's a contact.
Yes.
A contact is a contact.
So you're talking about body fluids. As long as body fluid comes in, yeah.
Exactly, the body fluid. That's right.
Okay, so thank you for that, Doc. You know, we are dealing with some of the statements and things that people tend to believe out there. Now, one of the other things I would like you to speak about is the use of the morning after pill, we call it. The morning after pill. Would you say that it is a good way of a good contraceptive method, or should the other more traditional types of contraceptive be used? Because are there any side effects to it? Is there any long-term harm that can be caused from using it?
Very nice question. For and of course, docs. While you at it, how
Yes.
how many can one a female supposed to take for a year?
How many?
Yes. While you at it.
Okay. Okay. The morning after is a normal is a normal birth control. But the thing is, it can take they have it's a plan B without any complication. But if you cannot miss, you cannot take more than 2 doses, okay? To resume for the I will answer for first if you don't mind.
Okay.
For the it's an emergency contraceptive as we can assume. But anything an emergency that doesn't mean you can take it abuse. So, but what it can do, it will for sure it will change your next period. That one everybody can understand that. And then you will but even though you're taking it, you still have to You still have to consult your gynae because it can have some side effect afterward, like a dizziness, nausea, and etc. And then if you want to take another one, definitely you have to go and see the doctor. But it's not it's not recommended as a routine use because it can, yes, it prevents the pregnancy for unprotected sex, but it still have some side effect in it. As I tell you, it will mess up your next cycle, and then secondly, you can mess up your it can mess up the hormone. Remember, we have the 14 days before and the 14 days after. So the FSH and the LH play a very good role in any cycle. But if you can use it like once, it will be better. But you cannot use it more than once per month.
Okay. Thank you, Doc. Because that question, it is an emergency contraceptive pill, but what you find happening quite often is that women tend to have sexual intercourse and then they take it. So what is the correct way to use it in terms of the time within
Very
which
good.
you have to take it? So after you have had sexual intercourse, how effective would it be, for example, if you take it
24
5 days
hours.
later, or
24
is there a
hours.
specific time?
Yes, 24 hours. Like immediately up to 24 hours is more effective. But as soon as you get in that 48 to 72 hours, because the thing is, um, the semen alive up to 72 hours. So that is why the morning after, it will be more effective if you can take it before the 72 hours. Otherwise, it will damage any we can call it like a abortion afterwards, because the thing is the conception will be there already, but the morning after is not to kill like the conception. The morning after, it will avoid the conception to be um to be effective before the 72 hours.
Okay. So it's best taken within 24 hours or 1 day rather than 2 days
Yes,
or 3 days later.
yes.
And you said you would not advise for it to be taken as routine contraceptive. So people
No,
should
because it's
really
a
think
plan B.
about going and getting the pill or some other type of contraceptive instead.
Instead, because it is a plan B. That's why they call it emergency. So, and then that doesn't mean it will work too, because some people, that is why I mentioned, if you have to take more than 2 doses, you have to go to the doctor, because the thing is, that doesn't mean it will work. You can take it, but it doesn't work.
Because
If it
nothing is
doesn't work,
100% effective.
you cannot keep taking more than the 2 pills you have to take.
Okay. Wonderful. So, Doc,
And
our
if
next.
if you let that happen, as I tell you, after the 72 hours, because you miss your period, that not morning after, that abortion, because the cycle is ahead already.
Okay.
Very
All right.
nice.
So Doc, the next thing I'm going to ask you about, it it is somewhat related to doing stuff after you have had sexual intercourse. So for example, some people believe that douching or using some kind of vaginal wash after unprotected sex prevents pregnancy or kills off any infection.
Um, I don't think so, because I had that already, and they even informed that. Unfortunately, she does not prevent pregnancy. And it should never be used as a birth control either. Because as soon as you have sex and the unprotected sex, so you have to put in your mind within the ovulation period, so that a possibility for you to be fertile if it's normal women and to get pregnant. That doesn't help. No, it's a no.
Okay, thank you. So I'm going to move on. I think may have to skip a few. Um, this one came up as it relates to cervical cancer. Somebody asked the question whether rough sex is the person said cause. So rough sex can cause you to have cervical cancer. So could you explain for the public why that may not necessarily be a true statement?
Um, I will not say yes, because the thing is, the only concern, the only concern about rough sex, remember when you depend of the position. So if the penis touch, because some people have posterior cervix, anterior cervix. But when I say posterior is back, and then anterior is front or in the middle, because or if sometimes it's low. So if you have a low uterus, that means the cervix itself can be touched anytime. Some position for sure, like if you're sitting, like you're having oral sex, and then your cervix already damaged with multiple partner before. So as soon as that is why they call it when your cervix already inflamed, and then you exposed for cervicitis already. That means the cervix infection. And then if the penis, of course, touch it, yes, that can damage, but it's not like the raw sex will make you have a cervical cancer. The cervical cancer was already it's a threat for this woman, and then because the penis touch the cervix and can bleed, that can provoke the symptom to be more serious than before. But it's not the rough sex that give you the cervical cancer. No, the multiple partner, yes, and then because the rough sex provoke the bleeding or any inflammation in the cervix already, so that is why that will alarm the woman to go to see a doctor, and then they can find out it's friable. It's like a mucus, so the cervix, and then they will investigate and to get the cancer. But it's not per se it's a rough sex will give the cervical cancer,
Okay,
no.
thank
But
you.
the rough sex for sure can provoke like a cervix inflammation. We call it cervicitis. Yeah.
Okay. And since you're on that, what are some of the signs and symptoms that a person might experience with that um,
So
condition?
most most frequent is the bleeding after sex.
Okay.
Yes.
All right.
So that is why any gynae, any visit, you must ask that. If the person has pain during sex and any bleeding after sex. Because out of period, no women supposed to get bleeding after sex. Or of course, for the virgin people, I can understand that, because remember the muscle, all that will get affected. But to tell you personally, any woman have sex, no matter how hard it was, so you're not supposed to get any bleeding, any spotting after sex.
Okay. Thank you, Doc.
Okay.
Louisa has a question that you'd like to ask.
So one of the listeners asked is it healthy for the reproductive female reproductive organs to have men's sperm frequently in there? That's one of the questions a listener asked.
If the women can have sex frequently, the semen inside of her, like during ejaculation,
They said, is
that's
it
what you
healthy
mean?
for the female reproductive organs to have men's sperm frequently in there? I
It's
don't.
not a problem. It's not. It's nothing like dirty at all. It's just for sure we concerned about sexual infection, sexual disease during that time. But it's nothing like hygiene or is not healthy. As soon as the woman is okay for any eventual pregnancy or any eventual STI, STD, so it's okay to have the sperm. Yeah.
Okay, thank you, Doc. So we're going to move on to an area that is older persons. So let's talk a little bit about the women who are going through menopause. What kind of effect could menopause have on women's sexual and reproductive health, their sex drive, their ability to enjoy sex?
That's a very good question. And unfortunately, so I really hope a lot of older women like on live so to hear about it and some men too for their understanding regarding the women. So the loss of estrogen and testosterone following menopause unfortunately can bring a lot of changes in during the menopause by the woman body. And unfortunately during the sexual life for a sexual life is because of the hormone because most you having less estrogen most of the estrogen like less you have estrogen less we get dry even though it's not only menopause even though we in the menopause but I want to take the opportunity to say even for normal women the young women so that can happen as soon as you have a loss of estrogen that can happen you can be dry is not only for menopause.
So, what could
Is
cause that loss of estrogen in younger women since we're on the topic?
the younger woman is because of the disorder, the hormonal disorder. So most time when they have the fibroid or any serious polycystic ovaries, so that can happen. That can happen. So the they can have the imbalance between the estrogen and progesterone. As soon as you get that, that means so you have to sometimes they ask them to get some estrogen, to take some estrogen to balance
Oh,
their cycle. So but to get back to the menopause, so that is a normal, it's not like something like abnormal. That is normal for menopause to get a woman to get dry and to even not have the the feeling too, because unfortunately when you dry that can cause like a lack of feeling for sex.
so should older women just forget about having sex, doc, or is there something that can be
No,
done
not at all.
so that they
Not
can
at
have
all.
a fruitful sex life? I'm getting to
Not
that
at
age.
all. Any woman 70, 80 can still have sex, but we can give them. There are some lubricant we can advise them and to use before having sex, even though even out of sex. So because you can feel you dry, so that we can always give it to them for them to feel it. Because sometimes when you dry, sometimes when you dry, even though you're not having sex, you can get some cuts because remember you have to be moisturized so for any women so as soon as so the dryness come so we can always because unfortunately in our country the women are so educated and they're so ashamed to talk about it even though they go and see the doctor they let it so go so far And then unfortunately we cannot even help them later, because the thing is they feel it, but they don't talk about it. They feel ashamed with their husband or their partner, and then they prefer to say they're not in the mood to have sex, but it's not the cause. The cause is the dryness. But they feel like they're afraid to say what is true and to talk about it. So they prefer to come to get inside of them instead to talk about it. But the lubricant can work very much, and then we can even give them some estrogen. It's okay for a menopause woman to get some estrogen. That will be very good for them.
Okay, so Doc, you mentioned something, and I think as a society, culturally, it's kind of taboo for people, especially older persons, to talk openly about sex. So I can understand why some women would go to the doctor and they would not even mention that. That is why some women believe that after a certain age, when it starts to hurt when they have sex, because the dryness can cause a bit of pain, I would imagine.
Yes.
So
The dryness causes the
sorry,
pain.
I
That is
lost my
that
train
is
of
the
thought.
fear.
So
That
what
is the fear.
so what's about the women during menopause that have a high sex drive,
Exactly.
and then the men feel that they cannot handle the women with the high sex drive? So how do women handle that situation?
High sex drive. Uh, so I think I think for me, so I will not I will always advise like the first person who can help the women is the husband, the partner. So they have to get counselor. They have to talk about the phantasm in the during sex, and then they have to plan some romantic dates, because they have to get back like it's like a start over. So you have to have patience, They have to feel like mentally they're still women. They have to they have to use, as I tell you, some medication, like some dosage, some some gel, and then I think we have to help them. For us as a health team, we can have like a show for for those women to come and explain the situation. So some 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 men don't testify like their wife has no sex drive, you know, is because they do all that.
Okay, Doc, we understood you said normally that many women experience that dip in the sex drive, they no longer feel it. But Louisa was mentioning that there are some women who seem to be outside of the norm and they have a very high sex drive during the time of menopause. So, what happens in that case? I know maybe probably some of what you said in terms of that speaking with your partner, because when we talk about sexual and reproductive health, it's not just about the sex, it's about the relationship, it's about the communication. So part of that would be for both parties to understand where they are at and for them to try to find solutions, whether with a counselor or otherwise.
That's what I meant. I meant like the interest in sex and experience desire have to be in both sides. So the men have to play a big role for that, and then like to refer like by do, and then to engage some sexual activity, you know, and then to increase the desire of sex.
Okay, wonderful.
I
So,
don't
Doc,
know.
we
I
have
don't
been
know if
talking quite a
Lisa,
bit
I
about
don't know
women.
if Lisa want me to. I don't know what Lisa wanted more than that. Or I don't know. You have to tell me what what exactly you wanted me to mention
Mm.
or to clarify.
So your question, Louisa, the second
Yes,
time around.
you did answer the question to some extent, Doc. As it relates to the communication and so on, getting the counselor and to help each other out. I think you answered the question to some extent.
All right. So, Doc, someone is asking your question. The person is asking, does Viagra work for women as well to increase sexual sensitivity or any other way?
Viagra is more for men. Um, and remember, we cannot just go ahead to allow people to use the Viagra too. So we don't want to mention something here and for them to say, even the doctor advised the Viagra because the people have abuse of it. So that is why we don't want to just to focus about the Viagra because it's very important for us too because since we online, you just never know so they can use it against us because we have to I think we have to talk about that one day because that's a very important subject about the Viagra. But
Okay.
for my
So for
knowledge
now, you say it's best to have a conversation with your doctor
yes, about Viagra definitely
about Viagra.
you have to do some blood tests, some urine tests, and then heart like echocardiogram, cardiogram like your heart to check your heart, all that, and then you can go ahead. It's not anybody, and you have to know the dosage, all that. You can, your husband can take 100, for example, and nothing happened to it, and the other one takes 20, and it collapses. So
Okay.
that is a very important subject. I really hope anytime we can come with it because that damage a lot of person. Yeah.
And Doc, that leads us right into the next question, which relates to men. As men get older, we say in our local Creole, "Baila pa ka leve, Johnny Moore, Johnny is dead." So we're talking a little bit about erectile dysfunction or the ability to get and maintain an erection due sometimes to age, but we're relating it to age, but also to health conditions. So once a man starts to experience erectile dysfunction, he will no longer be able to get pleasure from sex. Is that a true statement, or is that something that requires more explanation?
Um, for those men who lose their erection, unfortunately, we have a lot to investigate. First of all, medication, the kind of health. For example, I know for the diabetic, the metformin, and then there are some hypertensive medication. All that can affect an older person. That doesn't mean the person like lose their erection, like cannot be fertile. It's because the side effect of those medication. Um, Now for the older men, that doesn't mean they're not fertile, even though the erection not there. Surprisingly, they can get somebody pregnant even though the erection not there. And that is why sometimes they fighting, they said, so I cannot even get hard and then you're pregnant. So look for I'm not your the child father thing that. But because remember, as we said, the fluid before the erection, so that can still be fertile. So for those men. So that doesn't, for my knowledge, they still have to use condom. It's not like it will not be like more like so effective for the young men, but they can still be fertile. So now, for the to get back now for your question about the erection, what they can do. So for the sexual infection, you said about the older women, men.
No, we were talking about erectile dysfunction, their ability. And in our culture, men seem to link or associate their manhood very much with their ability to have an erection, to have sex, to have children. So, erectile dysfunction can have quite an effect on a man psychologically, that
Hmm?
inability. I think that is probably a topic that we should probably have all on its own.
That one we have to definitely. I think that's two
All on
subjects
its
that are important here
yes.
because the erectile dysfunction that bring mentally the men don't take it easy at all. So and then in one side, I have to inform you all like we have a lot of serious problem about men in the age clinic because the thing is they refuse to admit they are sick. They refuse to admit they need help. They refuse to admit so their sexual health have to be taken care of. So they really think it's women only who have to take care of. But them as men, they think they're okay. And that is totally not true at all. Because any man, young or older men, especially the older men who have erectile dysfunction, they're supposed to go and see a doctor for that. Because as I tell you, we have to find out about the health function. So what is a what disease or any health problem, health concern about them? And secondly, we have to find out what is the cause of the erectile dysfunction because some of them they very take that very hard for their couple. They don't admit it, and then they feel like they're not men. They feel like they lose their virility. Yeah,
So, Doc, in a nutshell, you're asking men to stop playing macho, stop being macho.
exactly. Thank you.
Thank you, Ulan. Okay, so Doc, I think we will have to stop at this point because we have gone past our time already, but it was a pleasure having you. It's always a pleasure, and I hope that you will be able to join us at some other point in time. There
Oh
are some
yeah,
areas that we really need to talk about a little bit more
oh
to
yeah.
bring out into the open. Thank you for joining us, and
You're most welcome.
sure that our listeners got some very valuable information from your perspective here on the show this morning.
You're most welcome. It's a pleasure, and I'm looking forward already for our topic, the dysfunction erectile, Viagra. So that's very important because the sexual health reproductive by men, trust me, Fern, we are very far away in St. Lucia for the reality. They really, really give problem and give the women a very tough time.
Okay. Thank you, Doc. We will look into getting those topics up and running on the program this year.
Okay.
Definitely. I
Thank you,
concur.
doctor,
Yes.
so very
And I
On the
think
back.
I really enjoyed today's topic.
Okay. You're
Yes.
most welcome. It's a pleasure.
Have a good day.
Okay, same to you, friend. Bye
Bye.
bye. See
Bye
you.
bye.
Bye.
Okay.
All right, folks, we'll conclude the show.